Broadcast of this program is made possible in part by the South Carolina Farm Bureau, online at scfb.org, and by the Columbia Metropolitan Airport, online at columbiaairport.com, and by Time Warner Cable, online at timewarnercable.com.
And welcome back to State House Today as we continue in this session of the General Assembly. The Senate has passed and given initial approval to the Department of Administration bill. Gives final approval, it'll go over to the House of Representatives. The House of Representatives involved with the budget. The Ways and Means Committee is putting together the budget for this year. It'll go to the full House floor. From the House floor to come to the Senate. The Senate, of course, will put its view of the budget on there, and then they end up in a conference table. Some of the issues we could talk about today are issues that are in those budgets, and we've got a very interesting program, and particularly for our friends at 518 of the Lot Building, Representative Merrill and Stavernakis. We've got quite a few that enjoy this show. We got an interesting topic today. Transportation in South Carolina, Medicaid, seniors, what is it? Are there changes? A lot of interesting things that affect budgets and decisions that are made. But before we go to that and to our guest, a few housekeeping things to do here. We, of course, want to thank Time Warner Cable. We want to thank the Columbia Metropolitan Airport. And we also want to thank the Farm Bureau for making this broadcast possible. Educational television, we want to thank them for their services in the production of it, and also the help that we get from the South Carolina Press Association in putting the program together. With that, let me introduce to you our guests today. They come to us from two different directions. Senior Solutions, Mr. Doug Wright, comes to us from upstate. I don't know of really of anybody who doesn't know more about senior issues and about how to craft solutions than you, Doug. It's just impressive. You bring enthusiasm and everything to it. Gentleman right over to him, his right, Representative Dennis Moss, comes to us from also upstate. He has been real active in senior issues. He's real interested in making sure that seniors are not forgotten here in South Carolina. And he's also been concerned about transportation issues with seniors. I want to welcome both of you to the show.
Good morning. Thank you, Governor.
Let's get right into it with both of you. First of all, I'll start with you, Doug. Transportation system that we're talking about. Can you kind of tell the public out there, what is the transportation system for seniors, both Medicaid and seniors? What are we talking about in terms of the transportation system?
Well, what we're talking about, Governor, is that today, seniors and folks that use Medicaid normally have to go through the Medicaid brokerage system, which was a privatization project that Governor Sanford initiated a number of years ago. So people that need transportation have to go through that brokerage system. And providers like Council on Aging, which is what Senior Solutions is, and there are 40 others of us in the state follow along with that program.
All right, so that our viewers can understand exactly what we're talking about. We're talking about folks, seniors who need transportation, let's say to a doctor or to a senior center.
Now the senior centers
would be a hospital or what?
That's right. Senior centers, adult daycares, hospitals, doctor's appointments, dialysis clients, patients.
That can be life-saving then.
Oh, absolutely. Many of these are. Most of this is non-emergency, but things like dialysis, if you don't have dialysis every 2 or 3 days, then obviously it's life-threatening.
All right, and let's set the stage for the folks to understand. These are people spread out through a county, and there's been some needs assessment, I suspect, done that they don't have another way to get transportation. Is that a fair statement?
That's correct. They are Medicaid recipients, and that's what we're really talking about, Medicaid recipients for the brokerage system. They are Medicaid recipients, so therefore they have to go through the Medicaid qualifying process, which includes need and income.
All right, so we got the Medicaid transportation. Now let me ask you, is there transportation for other than Medicaid, let's say through Senior Solutions?
Yes, there is. What we try to do at Senior Solutions is to provide routes or trips that have multiple sources of funding, so that we have senior programs from the Office on Aging, we have Medicaid through the brokerage system, we have some folks that contribute, so it's a private pay source, and we have other contracts as well from other folks like hospitals and et cetera. We try to combine that so that if you're going to travel 40 miles, you try to put 2 or 3 different people on the van to cut down on your costs. If you try to do one person in one van, that trip obviously becomes very, very expensive. If you have one van and 4 clients on there, the trip costs less per person because you're actually trying to move 4 people. The problem that we're facing is that in the Medicaid program, which used to be run through the Council on Aging's, Department of Health and Human Services and the Council on Aging's work together as a partnership. We work directly for the state. And then you could, in fact, multi-load and get more than one person on the van for your trips. And it was very easy to do, and it worked for about 30 years.
So did that create a cash flow that allowed you to keep up the buses and replace them as the mileage got on them and to pay for things?
Well, it absolutely did, because of course you were the only provider in that county. So you knew that if you had 500 trips in a day, you knew you were going to have to do them. So you could plan your staff, you could plan your maintenance, you could plan your capital improvements, you know, when you had to buy new vans, because you always knew how many trips you were going to have from Medicaid as well as your senior programs every day.
So it gave you this stable picture to the future to be able to plan your expenditures and manage the transportation system. And I guess you got to know some of these people, and they got to know you.
Absolutely. You're a first name basis. All your drivers knew everybody on a first name basis. The people knew that if they were going to be a little bit late at the doctor's, or if they needed to, on the way home from the doctor's, they need to stop off at the pharmacy to get their prescriptions. All that stuff was done. If you had a hospital that had a discharge, someone had been staying in the hospital, needed a ride home, it was a conversation with people that, again, they've been doing people in our offices for 30 years. So everybody knew everybody. If you need to make, man, we've got a sick baby today, we need to get them to the doctor's this afternoon. Okay, well, we knew these people. We would arrange to have that done. Now with the brokerage system, there are lots of rules. And one of them is that you have to give a 3-day notice. So
3-day notice?
Right. So it's very difficult for them to do a emergency trip, something when someone's sick, to get that into the system. It's very difficult.
All right, so because I want to go to Representative Moss for the reason that I understand that you were unhappy with the changes that were made. What impresses me is your knowledge of the system and the audits. I think you asked for an LAC audit on it. They made a change. Tell me, tell our viewers, what is the change? What did they do with these contracts? I think they called it privatizing, didn't they?
Well, it was part of privatization, but when I came in the General Assembly January 2007, I was confronted by providers such as Senior Solutions, and I got to asking questions, and it became a problem all over the state that the people that were providing the service were having to go to this broker system. Now, the people that had been providing the service prior broker were still making the trips, but they were going to have to contract, instead of contracting with DHS or in the patient, they were going to have to contract with the broker. And so I started asking questions, and there's big money involved. It's a big dollar item in our budget. And so I wanted to know if it was going to save money or cost money, and I requested an audit. And in the 4 or 5 years that we've been in that system, it was a 3-year contract with an automatic 2-year extension. And we had a group of providers that came together and did the proper procedure, formed a company, and bid on this contract, and they were $11 million lower. And that kind of raised my idea.
Lower than what?
Than the people that got the brokers that got the contract.
Well, why would they give it to somebody, if they're $11 million lower, why would they give it to somebody else? What was the reason now?
DHS had it in their bid package that you could not be a provider and bid on the contract. You had to be away from the transportation system, and you could not provide this service. You had to be independent of it. And so that kind of...
Why is that?
That just was in their bid process.
So these folks who were providing the service, who got together and formed a company to bid, and were cheaper on the contract, didn't get it because the broker, they didn't have broker experience, or what? They had all the experience to run everything, but they didn't have this particular thing in what they call an RFP, I think. Is that?
Because they were a provider.
Because they were a provider.
They were a provider.
So the taxpayers are paying how much more now?
In the 4 years that we assessed it, and DHS hadn't gave me the latest numbers, and it was approximately $25 million that we spent more. And if we go by the $11 million in the lower budget process, you know, that's substantial money. And it just keeps escalating. Like within 90 days of the contract, when we went to the broker, they said there were some mistakes in the bidding process, and they let Logisticare and MRM and the other companies raise. They gave them a pay raise within 90 days of the initial contract.
Didn't the audit council, I think, looked at that, and I've got their audit here, and my memory is they didn't think too highly of that, did they?
They did not.
Well, let me ask you, after this change was made, and I want to go back and make sure that our viewers can understand everything. After this change was made, you've heard Doug say that they had, they thought they had identification with the riders and stuff. Tell me, did you get a chorus of praise about the new system from the folks that you heard from?
It's been one complaint after another one.
What kind of complaints?
Well, the patients had to have a 3-day window with 72-hour advance notice that they were going to need a ride to the doctor's office or dialysis.
But what if I woke up sick today and I needed to get to the doctor
You
today?
had trouble getting a ride. You would have trouble getting a ride.
Why? Because I have to give 72-hour notice or what?
That's correct. 72-hour notice.
Did you have to do that before?
No, sir.
How about a rider out there, let's say, because I'm interested in seniors. A lot of seniors are on walkers. They need that. They use these vehicles, I guess. Does anybody give them assistance to get on and off, or what? Did you have any complaints or anything on that?
Before the broker system, the providers did give them assistance. They would help them in and out of their van from their home to the vehicle. They would help them out of the vehicle into the doctor's office or wherever they were going. And when we went to the broker system, it was from curb to curb. They would pick them up where they were picking them up, whether it be the nursing home or their residence. And they would drop them off at the doctor's office or wherever at the curb, and it was up to the patient to get into the building.
But what about if they needed assistance?
They didn't assist them.
How
That
about
wasn't in the
assistance to
contract.
get on the bus?
Governor, what you're talking about is kind of common sense, you know, with seniors. You run the office on aging is in your office, and I mean seniors and walkers. I mean, you know, a lot of times at Senior Solutions we provide door-to-door service. We don't provide curb-to-curb service.
So explain to our viewers the difference in door-to-door, curb-to-curb, so they understand that.
Well, door-to-door means that you may have to go up to Susie's house and you may have to knock on the door 2 or 3 times. You might even have to go in and help her up out of the chair and get her walker and get her out and get her into the van. I mean, some of these folks they can't do it by themselves, and there's no one else there to do it. No one. All right, well, if it's curb to curb, some of the providers that the brokers are brought in, I mean, they're going strictly by the contract. So they drive their van up, park, honk the horn. You can't, if you're not out there in 10 minutes, that's all they're required to wait. Off they go. You missed your ride. Well, she's sitting in there. She might not be able to hear the horn. She can't get up anyway. I mean, our folks at Senior Solutions, I mean, we've been dealing with seniors for 43 years. All right, we understand that sometimes they need a little bit more help than what is on this RFP. So, you know, we understand that you just have to use common sense, and that's kind of what I was trying to get back with Representative Moss and you. Let's use some common sense in this system. We may need, you know, a mechanism to handle the calls, et cetera, but common sense. I mean, you know, if you know Sally, you know she's in a walker, you know she needs help. I mean, you know you have to go to the door. You do. Now, the next person that you go to might not need that. They might be sitting out there on the curb. They might be ready to go. But if you do these trips every day and you do them for years and it's the same driver, the same van, the same clients, everybody knows one another. It's called relationships. And you know that's how we work in South Carolina, with relationships. But the brokerage system has put this bureaucratic buffer in there that doesn't allow for those relationships. So you can't call up and say, we need to get somebody to the doctors today. You know, you got to fit this in somehow. We don't have that kind of, we don't have those relationships with the dialysis centers, with the hospitals. We don't have that anymore because there's something in the middle. We don't work for the state of South Carolina anymore. We work for a broker. And there's competing interests, business interests. You know, the brokers are for-profit entities, you know, and they're very good at what they do. I mean, they're designed to make a profit.
So they're not operating the buses? The brokers don't operate the buses?
Absolutely not. They're not allowed to. They have to have providers like Senior Solutions operate the buses. Now, what they do is they act as the conduit from the client or the dialysis center for the trips, and then they broker out. So many providers have to do these trips. So Sally doesn't actually talk to the people that are going to come pick her up anymore. She can't do that. She has to call a 1-800 number, and then she has to push a number of buttons, and then she has to wait for somebody to get to answer. And you know, the RFP requires that they answer the phone within such and such a time, but what it doesn't say is you can answer it, put you on hold, and make you wait again. And so we have the struggle all the time, particularly on return trips, because you're talking initially door to door. You're talking about taking Sally from her home into the hospital or the doctor's office or whatever. But also when Sally finishes her visit at the doctor, she has to have a return trip home. Well, in the past, the doctor's office would simply call Senior Solutions and say, hey, Sally's ready, and you know, come pick her up. And we'd go do that. Well, now the doctor's office has to also call the broker. So they have to call the broker and sit through the buttons to get the return trip. And then Logisticare, the broker, has to call Senior Solutions and say, go get them. Sometimes there can be as much as an hour span between when the doctor's office calls to say for the return trip and when Senior Solutions even gets the call. And then we have an hour after that to pick them up. So sometimes that client's waiting 2 hours when they didn't have to wait anywhere near that.
But let me ask you, and I'm sure the viewers, this question comes up as I'm learning about this too. Are they paid, if they're paid for the trips to go pick them up, wouldn't there be an incentive for them to get them as fast as they can, or they don't get paid for the trips? What do they get paid? How do they get paid?
They get paid by the eligible people that are in Medicaid. So if there is 500,000 people in Medicaid, 1 million people, I don't know what the number is. But
there's approximately 500,000 seniors that are eligible for non-emergency transportation.
So they get paid for that 500,000 trips, or they don't get paid?
No, they get paid for eligible people that are in Medicaid, whether they take a trip or not. Actually, the incentive for the broker is, well, don't give a trip. I mean, you know, if it's harder to get through the telephone system, if they don't meet the 72 hours, if you have to call twice to get 2 trips rather than doing it all with one. I mean, you know, let's face it, businesses, for them is business. If I'm going to get paid whether you take the trip or not, it would seem that they might be able to stretch that a little bit. Well, why bother to take the trip?
So, all right, we're getting a shorter and shorter on time. This is really an interesting subject. Representative Moss, let me ask you, did HHS do any pilot project or anything before they made this change?
No, they didn't, and that was one of the big concerns. It was just a blanket statewide switch over to go to the broker system, and there were problems. When they first started, they wanted to go from a non-emergency ambulance situation where you had EMTs, you had people, and you got seniors being transported. They got medical issues, and so if they had a problem, they started stretcher vans in this process after the broker system got in, and they started even using taxis to transport people. I had one complaint that they sent a taxi from Myrtle Beach to Columbia to take somebody to the hospital for a doctor's appointment. Just issues like that, and the complaints piled up, and from the LAC audit, the legislative audit, we were fronting the brokers the money. We paid them up front every month. You know, most businesses, you provide the service and then you bill for what you provided. Well, under the broker system, the audit says that we pay them at the first of the month, and then the broker paid the provider. And we had providers that were owed thousands of dollars, $40,000, $50,000, $60,000 that they were late getting their money, and they were having a line of credit, but the brokers were getting their money up front. So I don't know of many deals. They had a sweetheart deal with the state that somebody brokered for them, and they were getting paid up front to provide a service that they may provide. And the people that were actually providing the service were supposed to get their money within 30 to 60 days, and sometimes it was more than 120 days. And I had to call in, and I did meet with some of the brokers, and they finally were paid, but they were auditing them and wanted to know if it was a justified ride, did they overcharge, and I met with Robbie Kerr, the director of DHS, when this happened, and in Robbie's words, he didn't think this was a good deal for the state. He thought we were moving too much, too fast to go to this broker system. And we've had 2 directors since then, and it's been 6 years in, and the problem still exists. So apparently it's not working. In other states that have went through the broker system have had problems. The companies we deal with had problems in Missouri for price fixing. And so the reasons that we went to the broker system, I'd say we hired somebody that we should have did a pilot project to see if it was working.
Well, you know, I read the audit, and of course, it appeared to me they criticized us, saying there are no goals here regarding cost. I think they used the word goal and performance measures were not established for cost and for quality of service. And that was one of their criticisms. Let me ask you, we're running out of time. You run a dynamic system up there. I'm telling you that you face because I've eyewitnessed it. Thank you, sir. I'd like your perspective. What is this broker system, in your opinion, as a provider of transportation for seniors? Is it, from your point of view, is it a good thing for South Carolina? What's the net effect of this system? Or is it going to hurt us long term?
Well, long term, it's going to definitely hurt us, because what's happened is we no longer work for the state of South Carolina. We work for the broker, and we're spending more money to get the service done. Providers are getting paid less money. So if you take what the state pays out and what the providers are getting to provide the service, the difference is what the broker is keeping. So that money is now going out of state. It's not staying in state to be reinvested in the capitalization for these huge vans that we have to have. These vans cost $65,000 a piece or more, and for the big wheelchair vans. And we cannot replace them. We have worn out 23 vehicles just since this system has started that we have not been able to replace.
Where's that money going to come from in the future, I guess?
Well, that's
Yeah.
that's a what is that, a $50 million question, or whatever you want to, whatever number you want to put on. In my understanding, for the Medicaid system in South Carolina, it is a federal mandate that you have to provide Medicaid transportation, or you don't get any Medicaid funds into the state, which are billions of dollars.
So we have to provide Medicaid transportation.
You do, and my scenario is for you and folks here and Representative Moss to think about is, if the infrastructure for the senior business is crumbling, is destroyed, and most of the large providers are dropping out of the Medicaid system, and most of the fleets are crumbling, what happens if the broker should decide to leave? Which we did lose one broker. MTM, by the way, has left. And now we're left with one broker, now Logisticare. If they decide to leave South Carolina, what happens to the crumbling fleet? I mean, it can't be replaced. Who's going to replace it? Senior Solutions can't buy 20, 30 new vehicles tomorrow at $60,000 a piece. Can you imagine how much money that is? And multiply that by 40 counties. What's going to happen? And yet, the state of South Carolina must provide Medicaid transportation to get Medicaid funding from the federal government. So the answer is, it's going to have to come from the state.
Representative Moss, I guess we're both looking to you and asking you, is that a concern you got?
Oh, it's a great concern. And that's the problem with privatization. Some of the state agencies that have privatized services are going back to what I call the old way. The state is a nonprofit entity. It's designed to provide the services for the citizens that they can't provide for themselves. And the seniors is a growing population, and we got to care for them. And so a number of agencies that have tried to privatize, and I'll just mention a few, DOT. They are going to do a pilot project in Cherokee and Union counties as we speak to go back to cutting the grass instead of privatizing it. And I asked the question, I support you on it, but why are we doing it? Because we can do it cheaper. Because the companies are making money, they're for profit. They're for profit, and the brokers are for profit. So you can't convince me that we can't do it ourselves in-house cheaper than we can pay a broker that's got a bottom line and got investors that they're making a profit. Well,
some of the senior centers have told me that they used this cash flow. It helped them provide transportation, helped them provide services, and now that money's gone. What I'm hearing from you is we've got a fading fleet. We got fading time, unfortunately, and we got to wrap it up. So with that, we thank you for tuning in. I hope you enjoyed it. We'll be back next week with another topic.
Broadcast of this program is made possible in part by the South Carolina Farm Bureau, online at scfb.org. And by the Columbia Metropolitan Airport, online at columbiaairport.com. And by Time Warner Cable, online at timewarnercable.com.